In this video, we are going to talk about the fundamentals of erectile dysfunction or erectile disorder. What is it? Who receives it? The signs and symptoms, potential cause, risk factors, prognosis, and the dysfunction treatments. Whether you are seeking out solutions for yourself or for a person you love, we are right here to offer you the excellent records available. Erectile disorder, additionally called impotence, is described via way of means of trouble getting and preserving an erection or having problem with erectile function. It may be an embarrassing component to speak approximately. More than 1 out of 2 guys during their 40 and 70 revel in a few shape of dysfunction, so take consolation in understanding which you are not alone. Sometimes having trouble with erection on occasions is normal, but ongoing problem can result in stress, lack of self-confidence, and several dating problems. So if you doubt in having erectile disorder, then don't hesitate. Seek help from your nearest health practitioner. Sexual arousal is a complex process. It includes your brain, hormones, nerves, muscle tissue, and blood vessels. A hiccup in any of these can reason a problem. Erectile disorder influences guys of all a while. However, as you get older, your chance can increase due to lack of oxide levels. Similarly, there are different contributing elements that can come into play. Physical problems like coronary heart disease, excessive cholesterol, blood pressure, diabetes, obesity, and smoking can be a reason for erectile disorder. On the opposite hand, depression, anxiety, stress, dating problems, and different intellectual fitness worries also can intrude with sexual feelings, and this could reason or even worsen your erectile problems. It is vital to recognize one's bodily and mental country to recognize underlying reason for erectile disorder. If you have chronic hassle getting or preserving an erection, or if you are experiencing any of those signs and symptoms, then seek for health practitioner or an internist without any hesitation. Usually the toughest part of diagnosing an erectile disorder is overcoming that embarrassment to speak to your health practitioner. But after you speak about it, you will discover that it is common and a prognosis can manifest quickly. For many men, a bodily examination and answering few primary questions is all needed. But if you've got continual fitness situation or any underlying situation, then you may want similarly assessments or a session with specialist. Millions of guys are capable of dealing with their erectile disorder. Oral prescription of medicinal drugs is one of the famous route. Taking medicinal drugs does not robotically produce an erection, but it expands the outcome of nitric oxide that relaxes muscle tissue of the penis. Sexual stimulation releases this chemical, and those medicinal drugs decorate its effect, bearing in mind an erection. Other common, however effective means consist of injections or urethral suppositories. If medicines does not work properly, then doctor might recommend a vacuum penis pump. It draws blood into your penis to create blood flow. Penile prosthesis or implants are every other choice. It contains surgically putting tool that permits penis to acquire erection. If your erectile disorder is impacting your dating, then doctor might recommend you and your accomplice to visit psychologist or a sexual therapist. Your health practitioner will help you in your journey to recover erection. Having timely erection trouble isn't necessarily a cause for concern. But if it is an ongoing issue, it can cause stress and affect your relationship. Erectile disorder can also be a sign of any underlying health condition. It may need immediate treatment or might be a risk factor for heart disease. So if you are concerned about erectile disorder, then talk to your doctor. Sometimes, treating an underlying condition is enough to reverse erectile disorder. In other cases, medications, L-orthogonine, or other direct treatments might be needed.